Criminology Board Exam Reviewer. Forensic Medicine. Definition of terms. Part 4. Esophagus. It is the portion of the digestive canal extending from the throat to the stomach, also referred to as gullet. Eunuchs. They are male prostitutes. Euthanasia, mercy killing. It means producing painless death of a person suffering from hopelessly incurable and painful disease. Exoskeleton. It is a skeleton on the outside of the body whose inner walls serves as a point for the attachment of muscles. Feces. These are animal solid waste material discharged from the rectum through the anus. They are the end product of digestion after absorption of nutrients and reabsorption of water. Fellatio. It is the oral stimulation or manipulation of the penis either by the female or male. Fetishism. It is the sexual satisfaction by contact with articles of opposite sex. Forensic medicine. It is the application of medical knowledge in the administration of law and justice. Forensic taphonomy. It is the study of post-mortem processes affecting human remains for the purposes of interpreting forensic data. Fortunato Fedele. He is an Italian physician who, in 1602, published the first book on forensic medicine. Frigidity. It is the inability to start or to maintain the sexual arousal pattern in the female. Frotteurism. It is the contact with other persons to obtain sexual gratification. Gangrene. It is the death of tissue due to lack of blood supply. Gastritis. It is the inflammation of the stomach, characterized by epigastric pain or tenderness, nausea, vomiting, and systemic electrolyte changes if vomiting persists. Glaucoma. It is a disease of the eye characterized by abnormal and damaging high pressure in the eye, usually due to a blockage of the channel that normally allows the outflow of fluid from the eye. Hematology. It is the branch of biology that deals with blood and blood-forming organs. Hematoma. It is the accumulation of blood in the tissue due to internal hemorrhaging. A tumor of blood caused by leakage from damaged blood vessels. It contains enough blood to form a blood-filled space. Hemolysis. It is the destruction or dissolution of red blood cells in such a manner that hemoglobin is liberated into the medium in which the cells are suspended. Hemolytic anemia. Any anemia resulting from destruction of red blood cells. Hemophilia. It is a hereditary blood disease characterized by impaired coagulability of the blood and a strong tendency to bleed. Hemoptysis. It is the coughing and spitting of blood as a result of bleeding from any part of the respiratory tract. Hemorrhage. It is the escape of whole blood from a blood vessel. It is the abnormal internal or external bleeding. It may be venous, arterial, or capillary from blood vessels into the tissues, or into or from the body. Herniation. It is the rupture of tissue into an adjacent space due to internal pressure or swelling. Hijras. They are castrated eunuchs. Homosexuality. It means persistent emotional and physical attraction to members of same sex. Hymen. It is a thin membrane, in females, that separates the external genitalia from the vagina. The outer surface is a dry, squamous epithelium, and the inner surface is a moist mucous membrane. Hypothermia. It means having a body temperature below normal. Hypovolemia. It means diminished blood volume. Hypoxia. It is a condition in which below normal levels of oxygen are present in the air, blood, or body tissues, short of anoxia. Impetigo. It is a highly contagious, rapidly spreading skin disorder caused by Staphylococcus or Streptococcus and characterized by red blisters. Impetigo sometimes occurs as a result of poor hygiene.